Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the UK variant of COVID-19 now in the Philippines. The Health Department reports the new and more infectious strain was detected in a patient from Quezon City. The president explaining why he supports the Chinese-made Sinovac vaccine as he meets with his cabinet on the government's COVID response. San Lazaro Hospital Infectious Diseases Head, Dr. Rontgene Solante, joins us live. And Senate Majority Leader Tito Soto calls out a House panel for holding a constituent assembly before the resumption of Congress session. Will lawmakers succeed in changing the Constitution this time? House Committee on Constitutional Amendments Chair Alfredo Garbin tells us more in the program. The new and more infectious coronavirus variant, first detected in the United Kingdom, is now in the Philippines. The Health Department confirms this after samples from a Filipino who returned home from the United Arab Emirates yielded positive genome sequencing results. The DOH says the patient is a 29-year-old real estate agent of Barangay Camuning, Quezon City. He departed for Dubai with his girlfriend on December 27th for business and returned to the Philippines on January 7th. The Quezon City LGU is also conducting massive contact tracing and surveillance in the patient's community to determine the presence of clustered cases. Speaking to the nation last night, President Rodrigo Duterte said he hopes the vaccines will work against the new UK variant. President Duterte also expressed overwhelming support for the Chinese-made Sinovac vaccine. He says Chinese vaccines are as good as European and American-made anti-COVID shots. Here's the president in his own words.
Hindi nagkulang ang Chinese. Hindi sila nagkulang sa otak. Bright itong in-check. That they would not venture kung hindi sapat, it is not safe, sure, and secure. Yung tatlo, it must be safe, sigurado, sure, and secure. That is the guarantee. Ako, kung ano ang piliin ni Secretary Galvez would bind me. Parang ako na rin ang bumili ng bakuna.
Let's go straight to the source.
Ng bakuna na hindi tama.
Let's go straight to the source of the story. We have San Lazaro Hospital Infectious Diseases Head, Dr. Rontgene Solante. Dr. Solante, welcome to the source. Thank you for your time, Doctor.
Good morning, Pinky.
So the UK variant now in the Philippines. Dr. Solante, must we be alarmed?
Yes, definitely. We need to strengthen our health protocol measures, particularly in the public places. And I think one of the important aspect here is really looking at a possible local transmission.
Mm-hmm. In fact, that's very important because I wanted to talk about this contact tracing. It's very important that those people who may have had close contact with this male resident of Quezon City in the plane at yung kanyang pag-uwi, dapat po ay binabantayan ng mabuti.
Yeah, correct. Because if you look at the transmissibility rate of this UK variant, it's really enormous. It's like 70 to 80%. Yeah. And even if this patient or index patient only have mild symptoms and then he have had contacts prior to going to Dubai or after Dubai in the airplane and in the airport, that's something that we have to really consider.
Yeah. And I think it's important what you said, Dr. Solante, even before he left for Dubai. So let's backtrack a little bit on the first case. Okay, male resident of Quezon City, umalis po siya for Dubai last December 27 for business. December 27 yun, ha? Okay, so bumalik siya sa Pilipinas, January 7. That's a week ago. And then, swab siya at na-quarantine siya. January 8, nag-positive siya, so kinwarantine siya in a Quezon City facility. And the samples were taken to the Genome Center. And then 6 days later, it was found out that he is rather positive of the UK variant. Tell us, explain to us this kind of timeline. Kung nag-umpisa po siyang umalis ng December 27 at bumalik ng January 7. Very crucial pa rin po yung time period na yon.
Yes, because if you look at the incubation period of a coronavirus, it will range from 5 to 14 days. Even in some patients, it may be longer than 14 days, no? 21 days. And that's the reason why some of our quarantine protocol can last up to 21 days. But in this manner, if he left December 27, then we really need to enhance and probably go house to house for those individuals whom this patient had contact with. I think a week prior to this patient's departure to Dubai. Although in Dubai, when he was tested, he was negative. But again, part of the protocol, you still have to know, was there any local transmission at that point in time before he left?
And it's also important, Dr. Solante, to note that even if he resulted negative, pagdating po niya ng Dubai, kasi nga yung incubation period is such a long number of days that during the time that he turned out to be negative, rather in Dubai, pwede po siyang positive a few days before, 5 days before that, hindi ho ba?
Yeah, correct, precisely. No, that's the point here. That before he left, then all the contacts, the close contacts of this index case should also be tested and quarantined.
And your suggestion is this: if he left December 27, dapat since December 20 yung paghanap ng close contact a week before he left.
Yes.
Okay.
That's my point.
And here's another thing I wanted to ask you. You see, the UAE, from last I saw, sir, it's not part of the list of banned countries dahil nga because of these UK variant. How can this be kind of explained right now? It became a bit of a surprise personally for me because when I was talking to you, Sec Vergere, I thought initially na nung sinabi na nag-breaking news na nandito na yung UK variant, I thought it would be some of the close contact of the domestic helper who turned positive in Hong Kong of the UK variant. And then now we know, oh, this is a different case.
Okay, in a country where there was no reported of a UK variant and it was only known that because of a visitor that was tested positive, it is always that's one of the gap, no? Because there are countries that are not testing a lot of this, doing sequencing of all their positives. Maybe because of limitations in the diagnostic testing. But again, I would say it's really important that even if a country does not have any reported UK variant, as long as outside of anybody who is outside of the country, I think we have learned our lesson now. We have to really be vigilant in doing testing and doing sequencing, particularly anybody who is coming from any country.
Are you saying, though, doctor, that basically this ban to other countries renders it a futile exercise?
No, it's not, because we have identified already that the countries that are reporting the UK variant. But in countries that are not yet, we cannot totally assure that they don't have, because their ability to give us this information of a new UK variant in that country will also depend on how extensive are they doing the surveillance in that particular country. And in that manner, since we don't know and how good their surveillance is, then probably at this point, since we have now a case coming from a country that without any report of a UK variant, then I think we should now more or less debate to include countries that are not included to be tested also.
I see. But is it a good suggestion, you think, personally, to kind of expand this travel ban already? And how must we move forward? Because you're right, it depends on each country how they address the situation of COVID-19 in their respective countries, how they test, how they trace, etc.
No, at this point, I don't think we need to do that ban. for countries without any report of a UK variant. But I would say it would be enough that anybody coming from any place outside of the Philippines, I would say they should be tested and screened for COVID
I see.
infection.
And dapat lahat sundin yung 14 days
Yes.
in either a hotel or a quarantine facility. Hindi po dapat talaga bahay.
No, we don't
Okay.
encourage the home quarantine. It should be in what we call coordinated facility or quarantine facility so that they
I
can
guess
be monitored.
That's the safer way, ano po? Because minsan nga po, Dr. Solante, kulang pa yung 14-day quarantine eh.
Yes, the 14-day quarantine is enough days to observe these patients.
So, help us understand this UK variant. What's to know about it? The only thing I know, Dr. Solante, is it's more infectious, mas nakakahawa siya, pero hindi siya mas mapanganib.
Yes, precisely. No, that's the constant findings now, and in fact, that remains an important advantage of this new mutation of this new variant, being able to easily transmit because of the mutations on that new virus. And again, I think the other concern now is how does this new vaccines can be, or are the new vaccines
How
still
can they work?
effective or
Opo.
highly effective? No, and I think Pfizer did a test in their vaccine against this new variant, and they declared that it's still effective, can
Yeah.
still produce an antibody against the new variant. But
Yeah.
we don't know the other vaccines yet.
Exactly, that's where I wanted to go. I did read about that. The Pfizer says it still seems to work against the UK variant. But Dr. Solante, how many variants are we looking at right now?
Yeah, but I think the concern now is still the UK variant, no? And I think we just have to focus on that yet. But with the declaration of our government to do regular biogenomic surveillance, then that is one step, an important step to really assess the presence of this other variant in our country.
Let's look at the other factors involved here. The reproduction rate is higher now. I think it's at 1.13. Ibig sabihin, sa isang nahahawa, 1.13 ang pwedeng mahawa. Okay, tumaas na po yan. And then you have the possible holiday surge. Sabi po ni Yusek Vergere, itong holiday surge, let's look at the second or third week of January. And then, of course, the traslasyon, yun doon kung time period ang titingnan natin. Let's look at the end of January for the real results to actually come out if it was a super spreader or not. How is San Lazaro right now? Are there more positive cases? Tumataas na ho ba yung mga kaso?
Okay, for the last 2 to 3 weeks, especially after the holidays, our occupancy rate has remained less than 50%. And I think that's something that we will always be monitoring. If there will be possible surge of cases in the next week or two from now, since we are looking at a 14 to 21 days delay time since until the patient will become symptomatic. And second, also, we have some limitations here is that most of those that are infected are mildly symptomatic. So some of them might not be going to the hospitals, no? Some of them. So that alone is one factor that we cannot totally gauge that total admissions of patients is a sign that there is a surge of cases because majority of patients with COVID-19 will have mild symptoms.
And now that the UK variant is here, what do you suggest to the public? Ano hong dapat nating gawin?
Yeah, thank you for that. Now, then again, we would like to re-emphasize again the importance of compliance and strengthening our compliance to the minimum health protocol that was being recommended by all of us, the government, including the experts. And we should not be complacent that even though we don't have a surge of cases yet in some areas, but again, this is the time that we have to strengthen in terms of implementation of these health protocols.
So let's be all mindful of that. And because we've eased some of the restrictions, of course, because the economy needs to thrive. Pero what do you think, Dr. Solante, are the issues that we can become or policies that we can become or government should be stricter about? I'll give you an example. Maybe curfews. How about that? And ano pa ho ba while now that we know that this UK variant is here?
I think the government has already laid out the prevention protocols. Now it's just a matter of really implementing this sustained implementation at the level of the LGUs, at the level of the private sector, especially in the working community, that implement and what they call this compliance really of this health protocol is important. If you look at the way we are looking at people, it seems that in the streets there are crowding, and in fact some of them are not using face masks or face shield. No, and if you go to the market and the groceries, it has really changed a lot since when we had that stricter implementation of these health protocols, and I think that's really important. That alone, a very simple solution here, but it's difficult to really implement because I don't know the compliance among the public.
One last issue I wanted to discuss with you, Dr. Solante, is that the Sinovac vaccines are set to arrive in February, 50,000 doses. In March, about 950,000 doses. In April, about 1 million. And May, and then in June, about 2 million, which will total 25 to 30 million by the end of the year. At ang mangunguna po ay ang mga frontliners. That's you, sir. Are you willing to be vaccinated with Sinovac? Kasi kayo po mauuna.
Yeah, to tell you frankly, Pinky, we're so excited, and I'm really waiting that vaccine will be available now after approval from FDA, from regulatory offices. I think we should encourage everyone, especially the frontliners. No, they should receive the vaccine. I tell you how important that vaccine. This is the most important time, critical time to receive this vaccine in order for us to be protected against this pandemic.
So you're saying once it gets all the papers in, you're excited to be vaccinated with the Sinovac, sir?
Yes, any vaccine that is available as long as it passed through the proper appropriate regulatory process.
Maraming salamat po sa inyo, San Lazaro Hospital Infectious Diseases Head, Dr. Rontgene Solante. Thank you, sir.
Thank you. Thank you.
And Senate President Tito Soto calls on a House panel to wait before holding a constituent assembly. After the break, House Committee on Constitutional Amendments Chair Alfredo Garbin joins us live. This is The Source on CNN Philippines. Please stay tuned.